And this is the National Partnership's articulation of that vision based on some work that we did with actual consumers and caregivers in the context of some focus groups back about a year ago. And as you see, the stake that consumers and patients have in meaningful use is how are we going to use HIT to make sure that care is better coordinated, better planned, that everyone involved, patients, their caregivers, their providers, all have the information they need to make the most informed and best decisions for that individual patient that's possible. And then to make sure that these transitions of care run smoothly and effectively and safely, and that patients get the care that they need and want, and also that they don't get the care that they don't want. And that is directly related to having comprehensive information about both their illness and about what the treatment options are. And then finally, I think my slide has been a little jumbled here in the translation, but part of that is routinely assessing and improving the care, and that can come in many forms, particularly when you're talking about patient and consumer involvement there, the experience of care, disparities reduction, and then ultimately when we have these systems in place to make sure that we're all learning the lessons we need to learn from the actual process of care, and that's the feedback loop idea, and having a learning healthcare system, which I believe is also an IOM concept. So how innovation and use of HIT can support the consumer role in this vision. As I said, consumers have not only a stake, but they actually have a role to play in this transformation. First of all is setting and achieving personal health and wellness goals, and making sure that people have the ability to manage their care at home. And this is most pertinent to folks who have chronic illnesses, but can also apply to the young mother who's got 4 children and soccer practice and school and needs to get immunization records to various places, and there are a number of examples where that can be applied. Also making more informed decisions, as I talked about before. This is an issue both in terms of quality of care, but it also, I think, will have implications for cost effectiveness and making sure that the decisions that are made, if we make the decisions that are right for the patient, that are based on their individual needs, preferences, and values, I think the cost issue will also be addressed as a default on that, because there's evidence that when patients are fully informed of all of the options in front of them, very often they choose the least invasive option that there is, which generally turns out to be the less expensive option. And so patient-centered care is not only good for patients, I think it will be good for the system-wide and the sustainability of what we're doing. Participation in the active participation in the continuous improvement of care. As I mentioned before, experience of care is an important part of that, and we're also looking at other ways that patients that their input can be sought, whether that's through electronic means or other means, just in person, and through an interaction to improve care. But all of this, and making sure that patients are able to benefit and to take a role in improving care, requires a number of key functions from our HIT systems, and that would be the care coordination. Patient education is key too. The evidence is being generated much more quickly than providers can put that into practice, and so we need to make sure that that's available at their fingertips, but also that patients have access to that information too, because they certainly have access to the internet, and some of that information is good, some of it's not. So we need to make some connections here between physicians and professional care providers and patients using these electronic tools to make sure that the information that's at their fingertips is the information that's actually going to be useful. Two-way flow of information is critical. One of the main things that the National Partnership and the Consumer Partnership for eHealth, which is the coalition of patient and consumer advocates that we lead, one of the main things that we're advocating right now is the concept of giving patients access to their own information. I think it's pretty widespread now that people understand that patients need to be playing a more active role in their health and health care if we're going to improve health care. But the problem is that historically they've not had the information they need to do that. And so providing electronic information is the perfect way to start spreading that information to the people it needs to go to, and first and foremost being patients from the patient perspective, but also making sure that that information is useful. And then covered measurement of patient experience. Also, the timeliness of this access to health information. This will be a stepwise process. Ultimately, what we hope to have is the real-time access so that if you've got a patient at home managing a chronic illness, needing to monitor a lab, they don't need to come into the office to do that. They can do that from home and check it, or if you've got a care provider who's helping to care for the patient in the home, they can have access, of course, if they're given permission by the patient themselves, to access the information they need to be effective caregivers. And that way we can all work more as a team, both the professional caregivers, the family caregiver at home, and the patient themselves, to make sure that care is maximized. And then finally, patient engagement and activation. Information, of course, is key to all of this, and there are various tools, and forgive me again for coming in late, but I believe we've discussed some of those various tools, and one of the ones that's directed at consumers is the PHR, the personal health record, and that's certainly a good place to start. There are lots of examples of how they have been effectively used in some instances, but I like to talk about this not specific to a particular technology, because PHRs, while they're one example of what we could do, I think we need to approach this using various tools that can meet patients' various needs. For example, in the area of disparities, there's a real concern that a PHR may not be the greatest tool for those populations of patients because of access to internet issues, or even just having access to the technology itself to make use of a PHR. But as many of you probably know, the Pew Internet and the American Life Project has recently put out some information saying that use of mobile technology, and in particular cell phones and internet access using those kinds of technologies, is actually more ubiquitous in those populations than it is in the population sitting in this room. And so I think that's a huge opportunity, not only to engage patients broadly using HIT, but it's also an opportunity to really make sure that our advancement of HIT results in the reduction of disparities and, God forbid, not the growing of those disparities through the benefits being offered to some and not to others. So I like to talk about those technologies broadly, both in terms of PHRs, which is the more common example, but also the growing area of mobile health, mHealth, as some of you might have heard it referred to. And then finally, just talk about a little bit about HIT and improving care, but also in the context of overall reform and not just the incentives offered by ARA. I think the incentive money is there to spur areas where the market hasn't yet moved, and that's why we think it's so important that out the chute, part of the criteria for meaningfully using HIT needs to include elements of engaging patients and making information available to them. But in the context of overall reform, there's a lot of workflow and process change, as well as payment reform and all of the other elements of reform that need to be addressed. And HIT, I think, if viewed in that context, and if we don't just stop with the incentives, but view the incentives as a way to lay the groundwork that's necessary for the provisions that are actually in the reform law, then this can really have a huge impact. I will finish up here just a little more about workflow and process change. We're not talking about we are talking about technology, but this is not about the technology by itself. It's about improving care, and since we know that a lot of the processes of care that exist in provider settings now are not the most effective ones, and that's for multiple reasons, then part of this, I think, needs to be not just education about the technology that entity has purchased, but to make sure that we're taking a look at the various processes of care, and where they don't work, then let's figure out a new process and incorporate this new tool into as a support for a new process of care. And since we're talking in the context of meaningful use about providing patients with access to their own information, in my mind, having worked for 10 years in the provider setting, I can imagine train wrecks in terms of the whole workflow process of how are we going to do this, because this is not part of what we've been doing, at least not on a routine and regular basis for most providers. And so there may need to be new processes developed. And as a patient advocate, and also as someone who's worked in the provider setting, both as a provider but also in the quality improvement arena, I believe that wherever that process touches the patient, then that's a perfect opportunity to involve the patient in the quality improvement and workflow change, because they're the customers we're serving, and they oftentimes can see where the process is breaking down that maybe we don't see. And again, this relates to technology, and that's the tool that's meant to support the process. So it may be that the tool can be used to tweak that process some. So for the bottom line for consumers is that, again, this is not about technology. It's about transforming our care system in one that really meets the needs of patients and consumers and is patient-centered. This is, of course, the money for these incentives is provided through tax money and public money. So our feeling is that consumers really have to see a tangible difference as a result of their money being used for these investments. And what that will mean is better communication both between their providers and between their providers and them. They will need to see a difference in terms of how well their care is coordinated, and then their own access to the information they need to serve the role that they understand they have and that they want to have in improving their care. And it's going to take all of us working together. There are lots of examples here of great work already being done, and we're certainly here to bring the consumer perspective and to work with the other stakeholders to make sure that our collective expertise is marshaled to meet these challenges. So that's it.
Great, thank you. So we have a long list of questions here that have come in over the internet, and I want to make sure that we have a nice mix of questions from inside the room and outside. So if you can formulate your questions here, I'm going to start with a couple of summary questions from our virtual audience. So the first one, I think, Jeff, would start with you, and the question is, given your experience, could you help people understand what are the most valued services that your clients see, sort of what's at the top of the list? And then second, give us a perspective of how it developed over time in terms of who joined the exchange and what were they required to do at the time they joined.